Hello, good morning, good afternoon, everyone. Thank you for joining our webinar on transforming healthcare quality. We'll just give a couple more minutes for anyone else to show up, and then we'll be starting the webinar. Everyone will be in listen-only mode during the presentation, so all the mics will be muted. But if you have any questions, please feel free to use the chat window to type out any questions you might have, or we'll have a question section in the end of the presentation. Please let us know. Okay, I think we'll get started. People who are still joining can catch up. So today's topic is transforming healthcare quality, and our presenter has an experience of over 20 years in industry and healthcare, and she is Harita Moglisetti. If hopefully you guys can see a screen and hear us properly, and we'll get it under the way.
Thank you, Abhishek. Good morning, all of you. We are going to be presenting on the transforming healthcare quality. Thanks for taking time out of your busy schedule and joining our webinar. Our agenda today is going to be covering the current state of healthcare quality and risk management challenges that our hospital systems are facing, the role of structured risk assessment and event reporting or incident tracking, and how ISO 9001 and ISO 27001 improves hospital operations. We will have three polls scattered throughout our session that we would request you to actively participate in, which will be like an online poll. We'll have, as Abhishek mentioned, we'll have a question and answer session at the end. You can enter your question at any point and we will answer them at the end of the session. Just a disclaimer that this is not providing you any technical advice. It's only for training purposes. Just wanted to give you a brief overview on a few headlines that we had seen in the past couple of years. So on data breach issues and HIPAA violation penalties. To give an estimate of how much these settlements and penalties cost a system. So one of the scenarios was where a settlement was encountered for a data breach, which exposed the patient information, and that cost $1.2 million in the settlement. The other situation was another data breach in a senior living facility, and that settlement resulted in 6,500 for residents. So this emphasizes the significant financial consequences that a healthcare organization faces when patient data is compromised. Until I came across these, I didn't know it was in the order of this magnitude. And there are also civil and criminal penalties in certain HIPAA violation cases where costing up to $1.5 million and even leading up to 10 years in imprisonment, which is a big thing. And this also affects the brand reputation of the hospital, which is very hard to get back once it goes down. So it is very important that it highlights the seriousness with which the government treats patient data privacy and security. And if any violation on this or malicious intent is involved or unauthorized disclosure of patient information happens, it is a serious scenario, serious data breach issue. What are the current challenges that the hospitals face today? So we noticed that we have multiple scenarios of medical errors in these hospitals. And when there are medical errors, it is actually in some cases resulting in even deaths. So in the worldwide scenario, there are misdiagnosis, surgical mistakes, incorrect medication administration, also inadequate or miscommunication among healthcare providers that cause these kind of medical errors. And these undermine the overall quality of care and also diminish the patient trust in the healthcare system. As I was mentioning, brand reputation is a big part, and once the image is tarnished, it's a very big deal. So improving these clinical practices with better staffing, staff training, and enhanced communication systems are very essential in reducing these errors. The other scenario is data security threats. The ransomware attacks are attacking even the healthcare systems, and it's only growing. So these cybersecurity threats are a big deal. So according to all of you must have been through the CrowdStrike, or at least a few of your colleagues must have gone through the CrowdStrike, where in an organization about 10 to 30% or more had been impacted, and certain airlines had been impacted last year. And so how do we avoid such scenarios? How do we mitigate attacks like that ahead of time is a big scenario for the cybersecurity teams. The other scenario the hospital sees is underreporting of incidents. So eventually this weakens the patient safety initiatives because like many healthcare institutions have been struggling with this underreporting and near misses situations. And also in one case, it's because of fear of penalty or embarrassment that they don't want to report it. Or in certain scenarios, there is a lack of proper reporting system, which is user friendly. And all these scenarios result in underreporting. But there are consequences to that, right? So failure to report means missed opportunities for learning and improving them, improving the current safety protocols, and coming up with a best known method and implementing the corrective action plans and remedies from having these incidents to recur. So it's very important to document these when they happen. So the solution is to create a blame-free environment where healthcare workers are encouraged to report errors without fear of punishment. In a industry where I was working, we had a system called a safety buck. So if somebody identifies a issue, a safety buck of $1 was handed over by a colleague or anyone around. So that was encouraging people to report these kind of safety incidents and preventing issues from happening in future. Also, you must have heard of organizations which are like the take care of the regulatory, like compliance with HIPAA, Joint Commission, and ISO 9000 or ISO standards like ISO 9001 and 27001. So briefly, HIPAA is the Health Insurance Portability and Accountability Act. This focuses on patient privacy and data security. Joint Commission, it ensures the healthcare organizations meet quality and safety standards. And ISO standards are industry-wide. They provide frameworks for quality management and safety processes, and hospitals also adopt these ISO standards along with their other compliance scenarios. What is risk-based thinking? Let me go over what ISO 9001 is. ISO 9001 is an international standard for quality management systems. It is recognized globally. It provides a framework for organizations to ensure that their products and services meet customer and regulatory requirements consistently, and that quality is continuously improved. So ISO 9001 is another word for quality, you can say. So it promotes the process approach, which means managing and improving processes within an organization to achieve the desired outcomes. It ensures that activities are performed efficiently and effectively, and it also focuses on this risk-based thinking. So that's why I switched gears to ISO 9001 when I asked about what is risk-based thinking, because they are kind of synonyms. So it helps in taking a proactive approach to patient safety. So what is that? It is before anything happens, you need to think of scenario, right? Like if say there is some water on the floor, then it is obvious that we might fall, right? So a proactive approach is to wipe out the water or prevent water from falling. A small step would be from the cafe, if anybody is walking out of the cafe, make sure that every drink has a lid on top of it, right? That is a proactive approach. I just had a simple scenario, but that will identify and it will correlate to what it means by a proactive approach. Identifying and addressing potential risks before they escalate. So ISO 9001, while you are implementing these, it focuses on these continuous improvements to achieve better patient outcomes, and also embeds this risk management in the decision-making process. So every step along the way, it is going through this risk management philosophy, if I may say. It also enhances accountability and ownership, so that every single employee takes ownership, like the safety bug scenario, where everybody is empowered to provide input to if any incident has happened. We also have AI-based, risk-based thinking, right? Where humans may not be able to think all at once, but AI can help guide you. So AI can never replace, but it can help guide, and integrate the AI into these solutions would improve the processes as well. Just a case study of a hospital in Washington where in their nutritional facility, there were some non-compliance to some dietary standards, and there were manual processes that posed safety risks. So there were certain incidents that happened in that hospital. So what they did was to implement ISO 9000 standards, ISO 9001 standards in their clinical and financial processes. So how ISO 9001 works is you have a huge organization, but there are different departments in them, and you specifically identify the top one or two organizations that you want to take on first to get ISO 9001 implemented, and then move on to the rest. So the clinical and financial processes were encountered first in this scenario, and this transformed their food and nutritional services, and it significantly improved patient safety. So you would see a significant correlation in your improvement in the quality systems and quality outcomes, actually, once ISO 9001 is implemented in an organization. We have a poll.
Okay, thank you, everyone. We'll do a quick poll. The question for the first poll is, which approach do you believe is most effective in improving patient safety? Is it a proactive approach, identifying and mitigating risks before they occur? Is it a reactive approach, addressing issues as they arise, or are you just not aware? If everyone could take a moment to just quickly answer the poll. Okay, we have about 70% already voted. We'll give a couple more seconds. Okay, thank you everyone for the engagement. We have 100% people believing a proactive approach, identifying and mitigating risks before they even occur. Thank you so much.
Thank you. That's awesome that all of you are aware of this proactive approach and hopefully are implementing it in your current scenario. The next scenario is on incidents and event reporting. So why do hospitals need an effective event reporting system? So we need enhanced transparency and accountability. It identifies trends and recurring issues. It also reduces medical errors through these data-driven insights. So incidents range from, like, say, a fall incident, a medical error, surgical mistakes, patient infections, and misdiagnosis. So when you look at the incident reports and plot on a monthly or yearly basis, or also take a look at the AI-powered predictive analytics, which our solution has, which proactively identifies the potential risks, which enables these hospitals to take preventive actions ahead of time so that these incidents won't occur in future, or it even reduces the effect of these incidents in future, right? We also have like a corrective action plan and root cause analysis that guides us. So if a particular incident has happened, how do you prevent them from happening, or even reduce the rate at which they're happening? So all these would improve the operational efficiency and drive patient safety. Our underlying mission of a healthcare system is to improve the patient safety. So our incident management also has the real-time tracking of these adverse events, automated reporting and analytics, and it complies with the hospital safety standards, along with AI-powered solutions. Here is a case study of a hospital in Louisiana, which did not have a beautiful or user-friendly event reporting system, and they were struggling with even entering an event into the system. So either they stopped using the system when it was hard to, or people were using it at a very low frequency. So the hospital system looked into their incidents and their reports, and were seeing those incidents happening over and over again. So they looked into why, and they adopted a user-friendly design, which was also a cost-effective tool with AI enhancements. And bingo, what is the result, right? It improved the patient reporting, or sorry, user-friendly reporting design, increase the rate at which users were reporting those incidents, and it improved patient safety because the data collection existed. You had enough data, and that helped with preventing the occurrence of future adverse events. And the staff was more engaged. The staff was encouraged into having a streamlined reporting process, and it empowered the team to participate in these patient safety initiatives. So we have another poll.
Okay, thank you. The question for this poll is, how effective do you think event reporting is in improving patient safety? It's very effective, not effective, or you're not aware. Meanwhile, guys, if you have any questions during the presentation, please feel free to use the chat window. We'll be constantly looking for any questions that you might have. Okay, we'll give a couple more seconds. Okay, thank you, everyone. And everyone believes it's very effective.
Awesome. So you guys are already aware. The next one is cybersecurity and ISO 27001 compliance within a healthcare network. So cybersecurity threats are facing the hospital today with different ransomware attacks, which disrupts the patient care. The HIPAA breaches happen, which result in costly fines and reputational damage of the brand. The data security risk for protected health information keeps happening. So what is ISO 27001? It is an international standard that provides a framework for implementing and improving an information security management system. So basically, it is designed to help organizations to protect their sensitive information through effective risk management practices. And this ensures that information security is systematically and continuously improved. So as we see here in the bullets, the ISO 27001, it is basically results in a robust information security policies, and that prevents or reduces the chances of breaches. And it implements a risk assessment framework. It also reduces any compliance risks or legal risks involved, and eventually results in reduction of any malware attacks and so on. Here is a case study of a hospital in the United Kingdom where they went digitized, and they had certain breaches. So what they went after is to implement this ISO 27001. So that addressed the security threats and the gaps and vulnerabilities they have. So these ISO processes actually look at every step. It's like they cross the T's and dot the I's at every physical and network level and operational level, right? So this one, it strengthens the information security framework, and obviously that helps in protecting the patient safety information, the patient data, and it complies with the international standards as well. So overall goal again is to improve the patient data safety, and that is what was the result after the implementation of ISO 27001. So there are various standards, but quality resonates with the ISO 9001, and one of the security cybersecurity standards is ISO 27001, which the hospitals networks seem to be adopting a lot more. Okay, we have another poll.
This would be the last poll, guys. Which of the following cyber threats do you believe possess risk to hospitals today? Ransom attacks during disrupting patient care, HIPAA breaches leading to fines and reputational damage, data security risk impacting PHI, predictive health information, or all of the above. Okay, thank you so much, guys. We appreciate your engagement. Results are 7% think ransom attacks disrupting patient care, 14% believe HIPAA breaches leading to fines and reputational damage, and 79% believe all of the above.
Yeah, so each of them is right. So whoever answered the first and second are right also, right? That ransomware attacks are one of them, HIPAA is another, data security is the other. So all of the above is the right overall answer, because every single scenario is being affected, healthcare networks are being affected to all these three situations. Okay, so how Health Talks benefits you in this journey? So we have governance, risk, and compliance solutions for the risk and incident management. So event reporting is user-friendly, and the AI-based risk and incident management features and enhancements that we have helps mitigate the future risks risks, and identifies the risks and incidents. So basically reduces your future chance of having incidents and so on. Along with our AI analytical services, where we have these beautiful Power BI reports and AI reports, which show the trends of where a particular incident is happening, particularly You can identify it to a particular organization. Is it in the nursing side? Is it in the surgical department, and so on, right? So reports highlight all those scenarios so that you can get a quick learning from those, and feedback you can provide a feedback directly to those high priority areas. So it identifies which are the high priority risks or the low impact efforts, so that you first go after the higher priority risk categories, right? And then go after the lower priority ones and mitigate them in those order of magnitude. The accreditation and certification, this is where the ISO 9001 and 27001 come in, where we help with the accreditation and certification processes, and we provide those consultant services. And during the implementation of these quality processes is where it identifies the vulnerability and the gaps that are involved in the healthcare network, and eventually achieves our goal, which is improved patient safety and care. So here we come to the end of our presentation. So it's in the question and answer session. So here are our contact details. If you have any more questions to learn more about our accreditation or ISO 9001, 27001, HIPAA, right, risk or event or anything related to the compliance solutions, you can give us a call or contact us through email. And here are our contacts where you can reach us through LinkedIn and so on, and we provide updates here as well. Okay, are there any questions?
I see one question. Are
Go
we
ahead.
required to report medical device errors? The answer is yes. And the thing is, FDA collects this data, and this can come from either the patient, or it can be a medical professional, or the hospital, or even the manufacturer, right? All of them, especially the medical device manufacturers, are required to report these incidents, as well as hospitals that face this incident. They are also required to report. The reason being that they maintain the database so that other organizations, when you are making new purchase decisions, can look at that database and make the right decision.
Okay, good. Thank you. Hope the answer helped.
Another question that is coming up is AI applicable to our organization? Very good question. AI is applicable to every organization. Probably this is the answer. If I ask you 5 years from now, you probably would say it's absolutely must for any organization. But today, every organization is in kind of a decision-making situation. In healthcare, we do see different opinions at this time. Some organizations have adopted AI fully, but healthcare is a very sensitive market, and we want to make sure that we make the right choices. There is a lot of risk involved with patient lives. So the answer is a definite yes. From, I mean, depends on people. From me, the answer is yes. The reason being, healthcare is not fully ready for AI. That is a given. But it will be in 5 years' time. Every organization will be forced to go into AI, and the best way to prepare for AI-centered solutions in maybe 2030 is to adopt AI in certain areas. For example, risk management, incident tracking. Those are areas where AI can look at data much better than humans can, much faster, and it can give you decisions. Of course, we need to put the guardrails around them, like we want to make sure we avoid the pitfalls of hallucinations and biased decisions. So as long as we take care of it and go with the proper approach, secured approach, I think AI is ready for certain areas. And in 5-10 years from now, there's no doubt AI will be everywhere, including medical, clinical decision making as well. We are not there fully yet. Only areas that we see right now is the radiology. There are leaps and bounds of improvements in AI-based healthcare, but other areas in treatment that will be coming soon. So the answer to that question is a yes.
Yeah, thank you. Actually, in the enterprise side, AI, wherein the risk and incident, it's a big deal, right? And it's happening. Okay, thanks for the questions and thank you all for joining. Have a nice day. So this ends our session. Thank you.
Thank you all.
Thank
Have
you.
a